Great. Welcome back, everybody. Although we had hoped that we would be able to make this a live interactive session, the more than unusual beginning to the school year has really made that impossible. Therefore, we encourage you all to listen to all of the health and safety information that we're presenting this morning. And you'll have an opportunity to submit any lingering questions through a Google link that will be included both in the introductory email that we'll send you, and also it can be found at the end of this presentation. Joining us today is our district physician, Dr. Ann England. You can wave, Ann. Assistant Superintendent for Human Resources, Dr. Jeremy Barker, and District Nursing Coordinator, Mrs. Dina Murphy. And I want to really thank them all for being here this morning. Okay, give me a second there we go. So our goal for this presentation is to both review and clarify district safety and health protocols. This is all in an effort to assure that there's a common understanding and a dissemination of the facts, the expectations, and the procedures to support the wellness of not only ourselves, but of course, our students as well. As we launch the year, we shouldn't really forget that the past year really provided us with a lot of experience and a lot of knowledge that's really going to serve us well as we continue through the months. In Dr. England's words, we have a playbook, but we've fine-tuned a few of the plays, and that's really what we're here to talk to you about this morning. We do know that Larchmont-Mamaroneck community is a high transmission community. But as a school district, we really have been a low transmission environment. There have been very few positive cases in the past year that we could trace actually to an internal transmission. And it's important for us to all keep that in mind as we, as we begin this school year actually today. We also know from experience that what we cover today is going to be part of this rapidly changing landscape. And that since this time last year, many of our staff and students have been vaccinated, and that's really good news. And of course, as news changes, as things evolve, we'll continue to refine our protocols and make sure that we turnkey that information out to you. But the real key is going to be consistent, accurate, and forthright practices, because it's really only working together in the same way and staying aligned that will once again be successful. And we were successful last year, and we need to think about that every day when we step into our schools. So remember, stay home if you're sick, wear your mask, and social distance. And based on Dr. England's advice, we will be abandoning, and we already have, our daily attestation forms, as well as temperature screenings. So let's talk a little bit about the reporting process should you be ill or be determined to be a direct contact outside of school. Okay. During contractual hours, employees should report any COVID-related concerns to their direct supervisor. Okay, let me make sure. Jeremy, you want to help me out with this a little bit? Is there anything you'd like to say about this?
Sure. The important thing is that if there are COVID-related concerns during the school day, we want your supervisor to know immediately. So that's why we do not want you to go to the link unless the information comes to you related to COVID after school hours. So that's why we've differentiated this in this way. So during the school day, you should report your concerns right to your immediate supervisor so she can engage the student support staff, Dr. Mazzoni, the nursing staff in taking proper steps from there. If it happens outside of the school day, then we're asking you to complete the same link that we had before. It's on the staff resources page. And that way we'll make sure that we have that information before we even get to the next school day.
Right. And I think one of the things you stressed when we were talking, Jeremy, was that you really don't need to send an email after you do the link.
That's correct.
The link is enough, and doing both of those things is unnecessary.
That's right. Thank you.
Okay, so when you have tests or related medical documentation, you're going to upload them to Human Resources using the Human Resources support link. And those are two different links, right, Jeremy?
That's right. They're both on the staff resources page. The one link is to report COVID-related information, and the human resources link, which is the typical link that we've had out for about 2 years now, whenever you submit inquiries to human resources, that's where you're going to submit any of your documentation. Again, please don't submit it through email. This is actually where we will electronically store any information that you submit, and allows us to go back and see the records and keep good records of what you submit. So the COVID link to report information, the HR link to send us test results.
Great. And I know, Jeremy, you're going to talk to us about the questions related to sick days.
Absolutely. So regarding now, if you become sick, you become quarantined, you become isolated, there is no longer a federal regulation. The federal regulation related to coronavirus, the Family First Coronavirus Act, expired last December 31st. However, there still is a regulation from New York State that's been in effect since 2020. And that regulation states that all public employers must provide at least 14 days of paid sick leave during an order of quarantine or isolation without loss of accrued sick leave. And there's nothing that you need to do other than report the isolation and turn in any related paperwork to us. And then we will make sure your days are coded properly so that it's not taken from your absence accruals. Now, an important note is that this is building on any previous absences you may have had. So this does go back to the inception of this regulation back in 2020. It's also important to note that under no circumstances under this regulation can you take more than 3 of these kinds of leaves. And the second and third leave would require positive COVID tests in order to access this provision. However, certainly if you are covered under an additional isolation or quarantine that is not covered under the New York State regulation, then you could certainly access your accrued sick or personal time for those absences.
Okay, thank you. And again, we encourage you to ask any follow-up questions using the link that we'll provide at the end of this. Thank you.
And Dr. Mazzoni, I'm sorry, can I add one more thing just to stress it? It is on the page here, but it's important to note that under the federal regulation that was in effect through December 31st of last year, there was potential coverage for paid leave for employees for childcare, for a child who's quarantined or isolated. There's no longer that provision in place. So therefore you could rely on whatever you're allowed contractually related to personal time for that purpose, but otherwise then that's not available through this New York sick leave law.
Thank you. Okay, I'm going to turn it over to Dina Murphy, who will talk to us about some of our basic guidelines.
Hello and welcome. I'm going to be talking about social distancing and how social distancing is a part of this layered approach to reducing the spread of COVID-19 and to minimize the need to quarantine. These are the recommendations at this point in time to reduce the risk of transmission. So a distance of 3 feet between students within the classroom combined with proper mask wearing and consistency. So a distance of 6 feet between students and their teachers combined with proper mask wearing, regardless of vaccine status. So teachers and staff must maintain 6 feet between students. Also a distance of 6 feet between teachers and staff who are not fully vaccinated combined with mask wearing. Move forward.
Dina, are you going to talk about what proper mask wearing is specifically?
Masks should be worn consistently and proper, meaning everyone's nose and mouth needs to be covered. There should be no space on the side of your mask, and it should be nice and tightly fit around your chin. So what is this K through 12 exception and what does it cover? So let's start out with a close contact. A close contact is someone who is closer than 6 feet to a positive case for more than 15 minutes over a 24-hour period. So unvaccinated individuals who are defined as a close contact must quarantine. But for students in the K through 12 classroom, there is an exception. So in the K through 12 indoor classroom setting, the close contact definition excludes students who were within 3 feet of an infected person. If both the infected and exposed student correctly and consistently wore well-fitting masks the entire time. So in other words, with proper distancing and masking in the classroom, students will not be quarantined unless they become symptomatic. The goal is to keep students in school. The data from last year shows us that the incidence of classroom transmission is very low. But as always, all quarantine decisions are made by Westchester County DOH based on the information that is provided to them by us.
Thanks, Dina. I know Dr. Englund will speak about it more, but I think another frequent question is, so why are the rules different for adults than they are students? It's not a Mamaroneck rule, right? It's not a Mamaroneck guideline. And I know Dr. Englund will talk a little bit more about that as she talks.
Gentlemen from Renewal Construction is here to pick up the rest of the stuff. Which people are helping out?
So this is a chart that just simply talks about masking, distancing, and quarantine per the DOH. So if students are vaccinated and they do have a classroom exposure and they are asymptomatic, there will be no quarantining. If we have students who are vaccinated and they have other exposures outside the classroom and they are asymptomatic, no symptoms, then there is no quarantining. So vaccinated students will be no quarantining for them as long as they are asymptomatic. Unvaccinated students are different. So we have that K through 12 exception. So as long as they're in the classroom, they have their masks on and they remain asymptomatic, they will not be quarantined. But if they have other exposure outside of the classroom and they are within the 6 feet for more than 15 minutes or more, we will be doing the contact tracing and they will be quarantined.
You know, when you say outside the classroom, you're not necessarily meaning outdoors, but you're defining the classroom as what? Because what about lunchtime on a rainy day?
Yes, that's correct. So if you're in the lunchroom and you are within 6 feet of a contact of a person who tests positive and you're with your without your mask for 15 minutes or more, you will be quarantined. It's not just, the classroom is just its one own entity. Beyond the classroom, we're back to our 6 feet and masking and unmasking and vaccinated and unvaccinated. So it changes up outside of the classroom, whether you're indoors or outdoors. As for staff, vaccinated staff, of course, do not have to quarantine if they are asymptomatic. The CDC, New York State Department of Health, and New York State Education Department all recommend PCR testing 3 to 5 days after exposure. And once again, if you're vaccinated and you're outside of the classroom setting, and no quarantine if you remain asymptomatic as a vaccinated staff member. Unvaccinated staff will have to quarantine if you are within 6 feet for 15 minutes or more, whether you are masked or unmasked, no matter what. If you're within that 6 feet and you fall into the close contact category, you will have to quarantine for 10 days.
And, you know, a piece of current change recently is with our gateway testing. We're moving into weekly surveillance testing. So vaccinated and unvaccinated individuals having nothing to do with exposure, just on a daily basis, you will have the option of being able to be tested, saliva-based PCR testing on a weekly basis, should you choose. So I just want to make a point of sharing that with people.
So the district is required to report all positive cases, contacts, and exposures to Westchester County DOH. Whether you need to quarantine or not, you can expect to hear from the DOH within a few days for a wellness check.
I want to ask a question. Something Dr. Mazzone just mentioned. Could you be clear again on who has to do weekly testing at school? Unvaccinated staff are required to test weekly. Is that correct?
That's correct.
Okay, so it's not if you choose, which were you?
Right. Thank you for that. I appreciate
Okay.
the clarification. What I meant to say was any individual has the option to be tested weekly, even vaccinated individuals. But if you are an unvaccinated employee, you must test weekly, and you'll be able to do that here at the school.
Okay.
Thank you, Anne.
Sure.
So in summary, vaccinations make a difference. Fully vaccinated, symptomatic teachers, staff, and students who were in close contact with someone who has COVID-19 do not need to quarantine. Unvaccinated teachers and staff who were in close contact with someone who has COVID-19 will be required to quarantine.
Okay, we'll turn it over to our district physician.
Which is not my picture.
No, it's not.
But thank you very much, everybody. It's really a pleasure to do this for the community. I've been a part of the Mamaroneck community for over 35 years, with my children all attending Mamaroneck schools, and for the last 12 years as medical director. So needless to say, this has been an amazing challenge for all of us. And so my first slide is titled, "Will we ever get back to normal?" And I think all of us through this year and a half have had our heroes and our mentors and our people that we follow, whether it's on podcasts or on, Instagram. And so one of mine is Dr. Ashish Jha, who is a doctor and a public health physician. He's the head of the public health department at Brown in Providence, Rhode Island. And I watch him whenever I can. He basically says COVID-19 is causing a deadly pandemic. We all know that. But what's different is let's focus on what we know. And so I refer back to what Dr. Mazzone and Dina Murphy both said, and that is that we have a playbook. We sort of know what we're doing. We just have to keep modifying as the rules change a little bit. And to also mention that what we did last year, which was the reason that we had very few cases in school, it was because we implemented distancing and masking even before we had vaccines. So it's not because the virus doesn't get to children and teachers, it's because we did the right thing. So the next slide is, a little bit of background on what about Delta. So Delta is a variant of the SARS-CoV-2 virus that arose last spring, first in Britain and then in India. Outbreak in India for sure, I got a lot of press. Delta is twice as contagious as Alpha was. And so much so that virtually all cases now in the United States are the Delta variant. They don't even test anymore. It was well over 95% in the end of August. And US cases have doubled in a month this summer, partly due to the fact that we've loosened up our behaviors, and Delta is so much more contagious, meaning that if you come in contact with a person with Delta within the limits of the distance and masking, you're twice as likely to catch it. The greatest risk, of course, is to people who are unvaccinated. I say of course, but we know that to be true because we've been watching the data on vaccinated and unvaccinated people. And so children are certainly among that group. The crazy thing about Delta is that it may cause more severe illness than previous variants, especially in unvaccinated people. See the next slide. So just a little more about this tricky Delta variant. There's a lot we still don't know. And almost daily, there is new data coming out from all over the world trying to understand a little bit better. But one thing that looks clear is that mild infections are probably milder than they were with the first variation of COVID, and serious infections may be worse than they were with Alpha. So we're seeing more illness and more serious illness, but we're also seeing more asymptomatic illness. But when we see more illness, we're seeing it more in unvaccinated people, and we're seeing it more, which means more in children. So of course, more children are getting it now because they are the vulnerable ones. It's as if, the Delta variant can pick out those people who are unvaccinated and unprotected. So we're seeing a lot more serious problems in kids. The next slide will delineate this a little bit. I'm just driving home because I'm a pediatrician. You can go ahead and switch. Just how bad this is for children. So in 1 week in mid-August, over 180,000 kids got COVID in the United States. The hospitalization rate in children doubled during that time. 1 in 56 sick children had to be hospitalized. And now the death rate for kids is now 1 per 10,000, which doesn't feel like a lot maybe, but at the current rates of kid COVID, that's 20 kids dying per week. Hopefully this is going to taper off as it did in India and Britain, but it may be starting, but we really can't let our guard down because the next group to get hit with the next variant will again be unvaccinated people. So just to remember that more infections means we're going to see more serious illness. You can flip. So how do we protect our staff and our kids and keep everybody in school? I go back to Dr. Jha, and let's focus on what we know. As we've already said, Dina said, masking, distancing, quarantining sick people, implementing good ventilation and rigorous testing, which we're definitely doing in Mamaroneck. And then finally, it's about vaccination. We know from these numbers that vaccination really does matter. Fully vaccinated staff will protect students and their own families as well as the wider community. We all have someone in our family who may be more vulnerable, whether it's asthma or cancer or an autoimmune disease. And these people, even if vaccinated, are still at risk of getting the illness from one of us if we're not vaccinated and or even vaccinated and asymptomatically spreading it and unwittingly spreading it. So that's where the combination of testing and masking and all these other issues comes in. Next slide. So we do know that there are breakthrough infections even in vaccinated people. How well do these vaccines protect against COVID and Delta? The answer is really well. And there's some really interesting and important data that shows us that vaccinated people are 90% less likely to get infected at all, 70% less likely to require any kind of treatment whatsoever, and 70% less likely to infect people around them. And finally, they are 90% or more less likely to be hospitalized or to die. So again, just underscoring, vaccinated people are most likely to get no COVID at all. But if they do, they usually are better within 2-3 weeks. They are not hospitalized and they do not die. So the data is very compelling. Some of it came from that famous episode in Provincetown last summer where several hundred people gathered, vaccinated people, several hundred people became symptomatic or not with COVID, and they tested. All of them were better within 3 weeks. Nobody was hospitalized, and nobody died. So it's very, that was very compelling. And that is why we suggested that, but the CDC suggested that we all mask, because that was the first evidence that vaccinated people can actually spread it. And in this case, they spread it to other vaccinated people. But what we don't want to do is spread it to our children or to vulnerable individuals. Next slide, please. So having said all that, we're bombarded with information and now mandates about getting vaccinated. And still there are many people who resist and have hesitation about getting vaccinated. So in the next few minutes, I just wanted to address, in the kindest, coercive way, as I can, some of the issues about hesitation to get vaccinated, what I've heard and what I've read. So the next slide. Some of these barriers are low and some of them are higher, barriers to vaccination that people perceive and feel and think about. And so I'm trying to sort of lay some groundwork for people to help if you're feeling ambivalent. If you're on the fence, how do you get over it and hurdle that fence? And to try to convince yourself and or vulnerable family members who also may be hesitant to get vaccinated. So the first one is, people say it costs too much. Well, that's just simply not the case. It's free. There are no strings attached. Anybody can get a vaccine, no insurance, no immigration information, no ID of any kind, and anybody can get vaccinated now. Tomorrow is an opportunity in Mamaroneck to do so. People say they can't access the vaccine or they don't have time. Time can be a factor. Very often people will feel a little under the weather for a day or two certainly after a second vaccine. And my answer to that is really, look at the best thing to do is to talk to your supervisor, take some Advil and Tylenol. Most people can go back to work. It's usually not, it's not like getting COVID. Another issue is people don't trust the government, quote unquote. In this case, the vaccine was developed by governments all over the world, China, India, Britain, France. And so there's been a lot of collaboration. It's not a US government thing. It's a worldwide effort to develop and test this vaccine. People also have said it wasn't tested in diverse populations. Now they're trying to experiment on me. Unless you're enrolled in a study, nobody's experimenting on you. And the diverse population concern is actually most of the testing was done in very diverse groups. Over 15% of the tested population was Latino, over 10% were African American, and over 25% were over age 60. So the marginalized, possibly marginalized groups were all looked at for school. The vaccine could make me sick. We've already talked about that a little bit. It doesn't give you COVID. It gives you some mild side effects, not that different from a flu shot. I have allergies, I can't take the vaccine. Well, that's not necessarily so. Many people can. If it's an allergy that might be triggered by the vaccine right away, there are ways to have the vaccine given that are much safer. The issue of pregnancy has recently again been looked at, and if you're pregnant or thinking of becoming pregnant, the wisest thing to do is actually to get a COVID vaccine, because it not only protects you from getting a serious life-threatening case of COVID, but it also sends antibodies to the fetus and allows that baby to be protected probably, we don't know for sure, but probably 6 months after birth. People say I had COVID, I don't need the vaccine. That's simply not the case. You still can get it, and if you get a vaccine, you're likely to be 3 or 4 times more protected than somebody who has had COVID and not vaccinated. Vaccine still increases your likelihood of a good outcome. The vaccine will affect my autoimmune disease. Again, people with autoimmune disease are often recommended by their providers to get vaccinated. If you were to get COVID, it would prevent you from having a worse case of COVID. Again, talk to your provider about this. It should not be an impediment. It is, it's what's keeping people out of work and out of the game because they're afraid they will get COVID. Next slide, Nora. So again, I bring back, let's focus on what we know. What we know is that vaccine does help in many, many, many dimensions of what we think about. And hopefully, if there are questions, you'll put them in the chat over the next week or so. I will do my best to answer any question anybody has. But again, I think your school nurses, your own provider, your specialty providers, if you have illnesses that make you worry about COVID vaccine, your pastor, your community leaders, everybody, engage everyone in a conversation to help you figure out your hesitation. And to everybody, best of luck this year.
Thank you, Dr. Englund.
Sure.
So we encourage you, we had hoped, as we said in the beginning, to have an interactive chat going on, but unfortunately we're not able to do that. But here on the slides, which we will also share out with you along with the video, there's a link where you can certainly submit any follow-up questions. And as Dr. Englund said, one of us will certainly attempt to respond to the best of our knowledge, right? There's also a lot out there that we still don't know, obviously, and we're learning at the same time. But please don't hesitate. I know Dr. Barker is there as a resource should you have questions about sick time, about particular family circumstances. And as Dr. Englund said, the school nurses are an amazingly valuable resource as well. And we hope to get this recording out today. Maybe with Dr. Barker's help, we can do that later because we do have a vaccine clinic tomorrow between 9 and 12 in the tiered classroom at Mamaroneck High School. The county is here doing it. It is the Pfizer vaccine. You can make an appointment using the link that was sent out community-wide, or you can just show up. And I'm sure your administrators would be happy to help arrange coverage or anything you need. Dr. Barker, do you want to say any more about that? Or is...
No, I totally agree. I'm sure as much as we're encouraging folks to be vaccinated, we'd be happy to support our employees if they can make it to the clinic tomorrow.
Great, thank you. So thank you, everyone. We wish you well, we wish you good health, and most importantly, a great start to the school year. Thank you.